A tracheostomy tube holder is the device which holds the tracheostomy tube around the neck. It can be made from various materials. The tracheostomy tube holder I will be using in this video uses Velcro to secure the tracheostomy tube around the neck. The items needed to change a tracheostomy tube holder include a tracheostomy tube holder, scissors, soap and water, gloves, which are optional, and a mirror for those changing their own tracheostomy tube holders. A few precautions should be taken before removing the old tracheostomy tube holder. First, if you're changing the tracheostomy tube holder on someone else, have the person lay down. This will prevent the tracheostomy tube from accidentally falling out when changing the tracheostomy tube holder. If you're changing your own tracheostomy tube holder, you will need to be sitting up to be able to watch yourself in a mirror. A mirror which is mounted on the wall is most helpful to use when changing a tracheostomy tube holder. Second, if the person has a cuffed tracheostomy tube, inflate the tracheostomy tube cuff before removing the tracheostomy tube holder. This will help prevent the tracheostomy tube from falling out. Lastly, if the person uses a ventilator and can safely breathe on his own for a short time, remove the ventilator air hose. The ventilator air hose is heavy and may pull out the tracheostomy tube when exchanging the tracheostomy tube holder. But please note, if the person cannot breathe on his own, please keep the person connected to the ventilator. Step 1. Wash your hands. Put on gloves. Optional. A note about using gloves. Using gloves will make the task of changing the tracheostomy tube holder more challenging. When I change my tracheostomy tube holder, I do not use gloves. Also, if my mom changes my tracheostomy tube holder, I do not make her wear gloves. Good hand washing hygiene is what we practice. However, anyone who does not live with me and who changes my tracheostomy tube holder, this includes nurses, doctors, respiratory therapists, or caregivers, I make the person wash his hands and wear gloves. People who work in the healthcare field are exposed to lots of different germs as they interact with patients. There is a high likelihood, even if the healthcare provider washes his hands, bacteria and viruses will still be present on his hands. To prevent infection, healthcare workers should wear gloves when doing respiratory care on a patient. Step 2. Open the tracheostomy tube holder package. Step 3. Measure the approximate length of the tracheostomy tube holder. The tracheostomy tube holder I use has Velcro on it to adjust to various neck sizes. Before I remove the old tracheostomy tube holder, I wrap the new tracheostomy tube holder around my neck and adjust the Velcro to the approximate length. I use scissors to cut off any excess. Step 4. Remove one end of the old tracheostomy tube holder. Step 5. Attach one end of the new tracheostomy tube holder. Step 6. Remove the other end of the tracheostomy tube holder. Step 7. Attach the other end of the new tracheostomy tube holder. Step 8. Make adjustments to more accurately fit the tracheostomy tube holder. The tracheostomy tube holder should be snug. 2 fingers should be able to fit between the tracheostomy tube holder and the person's neck. Thank you so much for joining me. Please remember to like and subscribe down below. And to all those who celebrate, Shana Tova. May the year 5783 be sweet like apples and honey. I hope you have a great day and a wonderful week. Bye-bye.
It's stuck. Oh, don't do that.